Hey there! Today I'm diving into everything you need to know about paracetamol, also known as acetaminophen. This popular medication is a non-opioid analgesic and antipyretic, meaning it's fantastic for pain relief and reducing fever. It's a go-to choice because it has a lower risk of causing stomach issues compared to NSAIDs. So how does it actually work? Paracetamol inhibits the enzyme cyclooxygenase, or COX, in the central nervous system, mainly COX-2. This reduces the production of prostaglandins, which are the culprits behind pain and fever. Unlike NSAIDs, it doesn't do much in the way of reducing inflammation, but that's actually why it's gentler on your stomach. Let's talk about pharmacokinetics and pharmacodynamics for a sec. Paracetamol is rapidly absorbed from the gut and hits peak levels in your blood within 30 to 60 minutes. It spreads well throughout body tissues and only about 20% binds to plasma proteins. The liver does the heavy lifting in breaking down paracetamol through glucuronidation and sulfation. A tiny portion forms a toxic metabolite, but don't worry, it's usually detoxified by glutathione. Lastly, it's excreted in the urine with a half-life of 2 to 3 hours at therapeutic doses. Now, what can you use it for? It's great for relieving mild to moderate pain like headaches, muscle aches, and osteoarthritis. It's also super effective at reducing fever from colds, the flu, and infections. Plus, it's a safer choice for those with gastrointestinal issues or aspirin sensitivity. What about side effects? At recommended doses, it's generally well tolerated. Common side effects might include nausea, a rash, or minor stomach discomfort. But be cautious. Overdosing can lead to serious liver damage, especially if combined with alcohol or in those with liver dysfunction. In rare cases, allergic reactions like Stevens-Johnson syndrome can occur. So there you have it, a quick rundown on paracetamol. Always remember to consult your healthcare provider before starting any medication. Stay healthy and see you in the next video.